In this box is a sample of what they believe to be the first live Omicron variant of COVID-19. It's just arrived here at the Centre for Virus Research in Glasgow. The reason I'm wearing all of this protective equipment that the scientists working here are, as well, this is a lab for handling live viruses. The fact they've got a live sample is really significant. When PCR tests get done, normally the virus is inactivated and is dead. So all the positive cases of Omicron we've had so far haven't been any use to researchers here. So this has been delivered specifically by Public Health Scotland to get them started in answering those urgent questions that we need answered about Omicron. Now they've got the sample, they can grow it up, infect human cells with it in this laboratory. And once they've grown the virus up to sufficient quantities, they'll have enough virus to be able to split it up and do these experiments. The first one, really, they want to do is to establish, is it going to be resistant to the vaccine, to the antibodies we have produced by vaccines? Is it going to avoid the vaccines that we have in a vaccinated population like the UK? That's a really crucial question, and they can start to answer it here. Other experiments they can do is to see, is it more infectious than previous variants of COVID-19? So far, the Delta variant, the one that's dominant now around the world, is by far the most infectious variant we've seen. If Omicron proved to be more infectious, that'd be a real problem. If it's less infectious, it's unlikely to become dominant. So that's another crucial question. And finally, they can perhaps address, or get some hints at least, is it more deadly, is it more pathogenic than other strains of COVID that have come so far? But it's important to say these experiments will take time. It's going to take several days just to isolate the virus. It's going to take several weeks to get all of those experiments done to answer those questions. But it is urgent that they're done because we need to know how to tailor our public health response in the face of this new variant.